Hey you guys, welcome back. Let's go and start a new chapter in our medical school career, and we're going to focus on pathology. Pathology is basically the study of diseases and the disease process in the body, and first we're going to begin with like the basics, so cell injury. Okay, so we should all know this. It's very damaging. Electron transport chain is our main source of energy, and it's a chain because it releases energy step by step by step. Because too much energy release will cause the cell to explode, and the most damaging species are going to be your superoxide, peroxide, and reactive oxygen species. The antioxidants, in order from strongest to least weakest, is vitamin C, A, and E. Homeostasis is the body's ability to adapt to the environment, and any inability is going to lead to cell injury. And the only exception to energy storage as a hydrophobic molecule is B12. And why is that important? B12 is the only water soluble energy molecule, and it's used for a whole lot of processes, and any deficiency in B12 will lead to neurological and nervous problems. And there's a certain extent where the body can compensate for the environmental changes, but threshold, once you exceed that threshold, is going to lead to irreversible changes, which will inevitably end in necrosis or apoptosis. So to respond to injury, there's either hyperplasia, which is increasing the amount of cells, or hypertrophy, which is increasing the size of the cell / tissue. The other response is going to be atrophy. In order to conserve energy, to conserve nutrients, sort of like if you were starving, to preserve your organs, your muscles would atrophy to decrease the nutritional requirement, right? And then metaplasia is when the cells switch from a certain cell type to another, so like squamous cell to columnar cell, and for a little bit that is going to be protective, but over time it will turn into dysplasia, which is like pre-cancerous. So if the adaptive capability is exceeded, it ends in apoptosis and necrosis, and then is replaced by different cells, and then it could unfortunately lead to cancer over time. So the different kinds of necrosis would be caseous and non-caseous necrosis. Caseous necrosis is when the cells are, or the damaged tissue is encased and is surrounded by these giant cells. The giant cells are just like a ton of macrophages fused together, and then it's also known as like epithelioid macrophages, and it results all in inflammation. So reversible injuries would be like hypoxia, which would be reduced oxidative phosphorylation, so just like a reduced amount of energy production. And because of that, sodium will enter, the cell will swell, and ATP will be used to shunt the excess sodium out, which reduces the oxidative phosphorylation. And without the ATP to shunt out the rest of the debris and build up in the cell, there's going to be an accumulation of acids and lipids and the loss of apoproteins, because there's not an ability to make the apoproteins. So there's going to be a hydropic change, which is the amount of water going in and out of the cell, and vacuolar degeneration. So the vacuoles will get smaller and smaller because of the loss of the apoprotein. To the cell membrane, the mitochondria, the endoplasmic reticulum, and the nucleus, of course, is the most sensitive to the hypoxic damage. So here we go. Ischemia, so lack of blood flow. and it's going to decrease the amount of oxygen available. So oxidative phosphorylation is going to be decreased. Of course, ATP isn't going to be produced, but ATP is also being used to pump out the sodium. So there's going to be an efflux of potassium. That's going to lead to the cellular swelling and the loss of the microvilli, blood formation, and more importantly, hyperkalemias or hyperpolarization in neuronal cells. So anaerobic glycolysis will increase because there's no oxygen, and lactic acid will increase, glycogen is going to be used up, and pH is going to decrease, which messes with the nucleus membrane, and it clumps the nuclear chromatin. Clumping of the chromatin is one of the signs to have the cell go into apoptosis. So with the decreased ATP, there's also a decrease of detachment of ribosomes, and without the ribosomes, there's going to be less proteins, and without proteins, there's just going to be lipid deposition. Irreversible damage is when the integrity of the cell membrane is completely compromised. So the lysozymes are going to be released. It eats away at the cell membrane, cell bursts. It can also eat away inside the cell, and amorphous densities will appear in the mitochondria. And in some cases, there's regeneration. So everything is gone, but the basal membrane is intact. And the cells have to be able to proliferate. So it's kind of like just starts from zero, and it like builds back up to the original tissue. On the other hand, there's going to be repair. So repair is when either the basal membrane is damaged or the cells are not going to be able to proliferate. These are going to be your like neurons. These are going to be your myocytes. These cells are like, there's no stem cells. There's no way for these to proliferate. There's no way for them to undergo mitosis. There's only repair. So repair is when collagen or fibrin is placed down, forming the scar tissue. So here are your causes of injury: hypoxia, like I said before, and the susceptible tissues are the watershed areas, so the places where there is less vascularity, the subendocardial tissue, the renal cortex, and the medulla. In ischemia, in mild ischemia, there's going to be a failure of the sodium pump, and that is going to have the influx of sodium and water, so that's reversible. Severe ischemia is when calcium is now coming into the cell along with sodium and water, and that causes the rupture of the lysosome. And then there's death by necrosis or apoptosis due to the release of cytochrome C. Cytochrome C comes from the mitochondria. Reperfusion injury, it's if you recanalize the heart too fast after like a myocardial infarction. Blood into the ischemic area brings more of the calcium in. Calcium is being called in due to signalings of cytokines, prostaglandins, and that overloads the mitochondria in the way I said before. So rupture of lysosome releases some cytochrome C, and then leukocytes respond to the the cytochrome C and apoptosis, and those come in, do their job, and then they generate a whole lot of free radicals and cytokines because these use lysosomes, remember? And then from there, the cytokines are released. It activates the complement systems and makes IgM or IgD antibodies. So all of this is kind of bad news. If you don't handle the heart attack correctly and the reperfusion occurs, in the end there's going to cause a heart failure due to all of the calcium coming in, mitochondria being overloaded, the influx of leukocytes, activation. All of this is going to lead to inflammation. Inflammation on the heart, bad news, because the heart is going to be covered by the pericardium, remember? So it's going to stretch, but the pericardium might not stretch fast enough, and it's going to compress the heart. Okay, so other things that damage the cells: chemical agents, drugs, and those injured directly by free radicals or by the conversion into toxic metabolites. We'll go through that in pharmacology. Carbon tetrachloride to carbon trichloride causes irreversible free radical damage and hepatic necrosis. So, where are these things from? This is from dry cleaning. So, if you ever have dry cleaning, it's best to either wear a mask if you work in the business, or when you bring your clothes home after the dry cleaners, leave them outside or in a well ventilated area for like a couple hours before wearing them or putting them back in your closet. Acetaminophen, remember, it will inhibit cyclooxygenase, and that creates free radicals, and from there that messes around with the liver and causes a reversible fatty liver, diffuse hepatic necrosis, and renal papillary necrosis. How does that happen? It causes too much of the it causes too much of the constriction, so like no blood flow. It's ischemia that leads into necrosis. So Tylenol, diabetes, sickle cell, pyelonephritis, so inflammation of the nephrons, will also cause these symptoms. Clinical apoptosis versus necrosis. There's always inflammation in necrosis. There's not so much inflammation in apoptosis because this is what the body is supposed to do. Necrosis means that there's always something wrong. So in Rey syndrome, there's going to be hepatic injury and hypoglycemia. There's going to be fatty liver changes, and it's going to also result in inflammation because there's going to be injury. Okay, so the depletion of ATP again is due to the influx of calcium, and a failure of a calcium ATPase pump is going to cause irreversible damage because the cytochrome C comes out, triggers apoptosis, decreased pH, remember, clumps the nuclear chromatin, lipid deposition occurs, wrong DNA will be transcribed, or it's going to be like mutated because of the clumping, and the proteins will be misfolded. Those aren't usable, and if those are used in like the membranes, that will also damage the membrane or make it unstable. And the 5-phospholipases and proteases released due to the other cells going through apoptosis, they're going to damage the cell membrane. Damaging the cell membrane is going to be irreversible cell injury. And then the endonucleases respond by fragmenting the DNA, and then the cell goes through apoptosis. So hypoxia in the muscles will cause hypertrophy. There's less oxygen since the coronary arteries are compressed, and in that the left heart will fail, and there's going to cause pulmonary edema. When the right heart fails, there's going to be systemic pitting edema, and usually it's from left to right heart failure. And then if there is something called cor pulmonale, there's going to be a lung to heart failure. So in the lung to heart failure, there's going to be dilation in the pulmonary arteries and veins. That doesn't occur in a right heart failure. So, hang on. It doesn't occur if if there is a non-cardiogenic pulmonary edema, but if there's any problems with the heart, there's going to be dilation in the lungs. Okay, so infarction, basically like tiny necrosis. There's in 20-30 minutes there is reversible myocardial injury. That's why you have to ask the patient, when have you been feeling this chest pain? Like, when did this chest pain start? And from there you can recanalize the blood to reestablish the blood flow and oxygen. The leukocytes will come in, do their job, and then after 45 minutes, it's not possible because a recanalization will lead to the reperfusion injury. And remember what I said, it's just going to end up in the activation of phospholipase A, and then cytochrome C will leak out, and then the cell will go through apoptosis. So the oxygen reactive species most commonly are the superoxide, peroxide, and hydroxyl radical. And they are made by the liver cytochrome P 450 enzyme. This doesn't, this is from the liver, not just the oxygen reactive species. These are made everywhere. But this is a very effective enzyme, and it can cause an enlarged area of necrosis and inflammation. And that's induced by acetaminophen, chlorotetrachloride or carbotetrachloride, chemo, the ischemia, reperfusion, injury, iron overload, aging, and microbial killing. It's like secondary because when the phagocytes release all the enzyme, it kills like literally everything around the pathogen. So red blood cells are the ones that you have to be worried about because they are the ones most exposed to reactive oxygen species. And to remove the free radicals, use antioxidants, so vitamin C, A, E, iron, and copper to chelate, catalase to break them down or inactivate them, along with superoxide dimutases. So the most important protector or antioxidant is glutathione peroxidase, and they need the liver enzyme G6Pase to make it. So the defects in membrane permeability will lead to the irreversible injury, and that causes causes injury to other organelles and increases the cytosolic calcium, which increases the oxidative stress and increases lipid peroxidation. So with that, the apolipine cysteine, asparase protease, CAPS-ACE are going to be activated, and those will activate the endonucleases to fragment the DNA, and the cell will go through apoptosis. In B cell leukemia, BCL2 is going to be increased in the serum, just a thing that you have to just pay attention to. But a different example is in menstruation. The endometrial cells will die from apoptosis due to the membrane permeability, but there's not going to be any fever. There's no leakage of oxygen species into the tissue because the tissue is just going to be released from the woman. In cytoskeletal damages, there can be the intermediate filament defects where the ubiquitin bound intermediate filaments are degraded. Mallory bodies, which are abnormal cytokeratin filaments, will accumulate, and neurofibrillary tangles from tau proteins and beta amyloid plaques are going to accumulate in Alzheimer's disease. Lewy bodies are abnormal deposits of the protein alpha-synuclein in the brain, and that results in the Lewy body dementia and Parkinson's. In patients with microtubule defects, dynein is going to be mutated. And in Carter-Jenner's syndrome, there's immobilization of the cilia and in the respiratory tract and inhibition of the sperm motility, and that's associated with dextrocardia. So metaplasia, like I said, is squamous to columnar. That's adenocarcinoma, and that occurs in Barrett's esophagus. So Barrett's esophagus is basically cancer due to the uncontrolled metaplasia. So like I said, at first it's protective, but over time, too many squamous cells, and that becomes a carcinoma because the squamous cells they're not that protective, and they have a much shorter lifespan. So there's going to be a constant turnover. And vitamin A is important for the Hox gene function. Remember that from embryology. And vitamin A deficiency will cause epithelial cell cancer. And any chaperone proteins that are damaged, they will result in misfolded proteins. These are things that can accumulate in the cells. The important ones to know are the ones that are exogenous, which comes from the environment, and endogenous, so these come from within. So just to repeat, these are adaptations to stress: hypertrophy, hyperplasia, atrophy, and metaplasia. So just to boil it down to a couple words, this is for basically just a strength, for strength, to conserve, and to protect. So in the subcellular response, there's going to be lysosomal catabolism in the atrophy, and it's induced by the small smooth endoplasmic reticulum, and in uses of barbiturates, those will induce the P450. CL4 becomes toxic, and then a combination of alcohol and barbiturates. That will alter the mitochondria, of course, and then it's going to alter the cytoskeleton. In some patients, there's going to be, after being exposed to a high level amount of heat or during heat stroke, there's going to be heat shock proteins produced. Autophagy is not just eating of the cells, but also eating inside the cell. So it's just a way for the body to recycle nutrients and organelles, and also a way to replace organelles once they've become too old. Let's see, the autophagosome is going to be made by a whole bunch of proteins, and they all act in coordination. Dysregulation of autophagy will result in cancers, IBS, and neurodegenerative disease. And let's see, plays a whole host role, and that's true because there's some microbes that only attach to a certain organelle, such as nucleus, like DNA, RNA viruses. And the autophagy will be pretty selective of what they eat up. Okay, so in morphology, reversible cell injury is going to be fatty changes, plasma membrane blebbing, loss of macrovilli, swelling of the cells and the organelles. And in necrosis, that's going to be kind of opposite. There's going to be shrinkage, fragmentation, increased eosinophilia, and leakage and enzymatic digestion of the cellular contents. So under different conditions, necrosis would have other patterns. So it could be coagulative, liquefactive, gangrenous, caseous, full fat, or fibrinoid. So that's it for now. Thank you for your attention, and good luck studying.